A very good morning to you and welcome to the first Africa Conference on Tobacco Control and Development. I'm Yuveka Rangapa. I am your English host for the next 3 days. You are stuck with me. We're going to become best friends. So let's pop on over to London, where we say bonjour. Yes, you heard right. We say bonjour to the lovely Anne-Marie. And I want to find out from you, Anne-Marie, bonjour. You've sent the London weather over here to Johannesburg. It is miserable out there. So I wonder if it's sunny outside your window there.
Bonjour Uveka. Well, these are 3 days for sharing. So I'm just sharing a little bit of my experience. Bonjour à tous. Je m'appelle Anne-Marie Diaz-Borges et je suis, comme l'a dit Uveka, votre modératrice pour le français durant ces 3 jours de travail et de réflexion autour de cette thématique si importante, la lutte contre le tabagisme sur le continent.
I want to first congratulate Africa for celebrating 10 years since we established this center. And this center is now, as it celebrates 10 years, we are hosting the first ever Africa Tobacco Control Conference on tobacco and development.
This conference becomes critical at this point to provide more insights to tackle the tobacco use epidemic and draw pathways for prevention, control and cessation programs, and address the main risk factor for non-communicable diseases.
To date, 44 of the 47 countries in the African region have become party to the WHO FCTC, and 20 of them have also joined the protocol to eliminate illicit trade in tobacco products, which entered into force in September 2018. In fact, we welcomed Ghana's ratification of the protocol only a few days ago when it joined other African countries in taking regulatory measures to prevent the trade of illicit tobacco products across their borders. And African parties to the convention and the protocol are not just paying lip service to its obligation. There is a clear commitment to the implementation of both treaties.
But acceptance of the FCTC and the protocol is not enough to protect the people in the region from the health, social, and economic effects of tobacco use and exposure to tobacco smoke. The implementation of comprehensive tobacco control programs, interventions, particularly at the country level, is what will save our population from the disabling diseases that are caused by tobacco use and exposure to tobacco use. And therefore, we need to work hard, all of us, to ensure that each and every country in our region implements comprehensive national tobacco control laws and regulations. And this is the only way that we are going actually to protect our region.
I cannot say there is one problem because it's always multi-causal, but I think that as in many other areas of the world, the interference of the tobacco industry and the perceived eventual benefits to some countries that still are producers of tobacco are the main thing. But definitely the interference of the industry is everywhere, and it's very important to avoid countries to really implement the FCTC.
We tend to focus so much on the problem and not the solution. And this will be my sincere advice to the tobacco control community. We need to step back and not chase after the tobacco industry. They need to be chasing after us. We need to be chasing after the policymakers and the public, the two most important constituencies for any public health agenda to be able to be successful. But we are chasing after the tobacco industry so much. Our conversation is 60–70% tobacco industry. If we ask what the problem is, if we ask what the barrier is, we tend to move towards tobacco industry, and therefore they become the conversation, not the solution. We need to move away from that and start talking about the solutions, putting the solutions on the table for policymakers and also for members of the public, ignoring, I'm not saying ignore the tobacco industry, but certainly don't make it your topic all the time. Let the topic be the solution and let the constituencies be the policymakers and members of the public. In this way, we set the agenda. Our conversation is the one that is being discussed, and therefore it's the one that is being paid attention to by both the policymakers and the tobacco industry. And I'm not saying it is easy, but I'm saying it is the path that is going to give us a new edge, particularly now when health and public health has become clearly a very, very important topic globally, and particularly so here in Africa. Change the narrative. Don't talk about the tobacco industry, talk about the possible solutions and engage with policymakers and the public. Thank you.
We all know that tobacco tax is the most effective tool we have to drive down consumption, yet it is the policy that is the most difficult to get, and it lags behind other policy progress that we've seen in other places.
Tobacco taxation is win-win-win. It's really a win for revenues.
You know that multi-sectoral support has been a song for most countries and also championed by the international community.
It is very crucial that we include a wide range of sectors and stakeholders who have different capabilities so that we have an improved implementation of our laws.
Botswana has just recently adopted, well, the law has been passed in Parliament. And one of the lessons that we learned was that the Global Adult Tobacco Survey was instrumental in defending a strong tobacco control law.